seconds or so, and you're good to go.
All right. Good morning, everybody. Thank you for joining. I am quite impressed with as many people that are showing up today. So I want to thank you all for spending your hour and a half with me this morning. So today we will be going over some common Medicare coverage problems or issues and what to do with the denied claim. Okay, sounds like we had some mood music going there. So, all right, and please don't hesitate to either type in the chat if you have any questions, or just yell them out to me, or I will definitely have questions at the end. Sydney, where did my presentation go? Sydney.
Sorry, we had one of the volunteers steal the ball from you, so I'm going to pass the ball back to you.
Okay.
Where'd the ball go?
Here, let me see if I can go back to, okay, there we go. Okay.
Okay, you got it. Perfect.
Okay. All right. Sorry, guys. Okay.
Nope,
What's the deal now?
Went away again. I'm not sure.
Why is it not? Let me try it again.
There it goes. There it goes.
Okay.
You're back. All right. If volunteers could not touch the ball, we'd appreciate that.
Please. Okay, so we'll be going over some common Medicare coverage problems or issues and what to do with the denied claim today. So here's some of the common problems that I have seen or that's just come up here recently. Denied skilled nursing facility stay, Medicare denied an ambulance service, or Medicare denied some durable medical equipment. Now, there are certain reasons why Medicare may have denied these, and we'll be going over those a little bit later. So some common problems I've seen in Advantage plans is that the Advantage plan denied physician services, the Advantage plan denied durable medical equipment, or Advantage plan denied the specialist. So there's some other problems, especially in both Original Medicare and the Advantage plan side. So we'll be going over both of those. So most of the time, how can you avoid these problems? One of the biggest is to make sure, if you're in Original Medicare, that they're going to a provider that takes assignment. So make sure your provider accepts Medicare or works with the Advantage plan. So there's 3 different types of Original Medicare providers. There's the participating providers. That's the ones that take assignment. So before you go to a physician, you need to make sure, and this is the question you need to ask, do you accept Medicare assignment? That means they have that contract with Medicare on what they're going to charge Medicare and what the payment that they're going to accept. Now, there is non-participating providers. Now, non-participating providers accept Medicare payment but do not take assignment. So these providers can actually charge 15% more than the approved amount. So beneficiaries may be paying more out of pocket for a non-participating provider. Another one is the opt-out providers. These providers do not take Medicare at all. They do not have an agreement to bill for Medicare. So beneficiaries may be paying out of pocket for the whole cost of these because if they're an opt-out provider, you can't even submit a claim to Medicare for these providers because they have opted out of Medicare. Okay, so the 2 types of providers for Advantage plans, pretty simple. Are they in-network or are they out-of-network providers? If they're in-network, then, you've got the co-pays and things like that. Now, if they're out-of-network, the Advantage plans pretty much will not, pay them whatsoever. So does anybody have any questions about those? If you do, raise your hand, and Sydney can unmute you or anything like that. Okay, so those are pretty straightforward. So, things to remember. One, do they take Medicare assignment if they're on original Medicare? The other, are they an in-network provider? That's the two things to remember. So, next thing is to make sure that you have actually followed Medicare's coverage rules or criteria. The biggest thing that Medicare I've seen denials for is the service was not medically necessary. The service may have been medically necessary, but the doctor didn't submit the proof that it was medically necessary, or the paperwork or whatever, something the doctor did not do as to why the claim was denied. So we need to make sure one wasn't medically necessary. Did it meet the criteria for Medicare coverage of a skilled nursing facility stay? I said skilled nursing facilities, most of the time you have to have those inpatient 3 midnights. And the big thing is inpatient. And I've been telling beneficiaries and trying to educate the volunteers that just because someone is admitted to the hospital doesn't mean that they are inpatient. If you're being admitted, you need to make sure, am I being admitted under observation or am I being admitted as an inpatient? That is the question that needs to be asked. Most of the time, if they're saying you're being admitted for observation, you're going in under outpatient, which comes out of the Part B, which does not count toward this 3 midnight inpatient stay. So just because they say they're being admitted does not mean that they're inpatient. And I keep telling beneficiaries, just because they're saying, because most beneficiaries think if they're saying, well, I'm being admitted, they think they're going inpatient when they're truly not. So that's a question that caregivers, beneficiaries, whoever is watching over this beneficiary needs to ask, am I going inpatient or under observation? Because that is the biggest thing right now. Next thing is, did you get preventive services too soon? You can only get a flu shot like once every year, and that actually has to be a 12-month period. You can't get it any sooner, or Medicare will deny it. Next thing that I have actually seen, were you transported to the nearest appropriate medical facility? For example, if you ask, if there's to go to a different hospital in a different town, yet there is one in your town that can treat the condition, Medicare's not going to pay for that ambulance transport to another facility if you go past the one that is appropriate. And I've had several of these where somebody has left like a hospital in Nashville, and they don't live in Nashville, like they lived, like an hour east or an hour west or whatever. And they were transporting them to a skilled nursing facility. Medicare denied that transport because they did not transport them to the nearest medical facility that they could get their therapy at. Another thing that I've seen, especially with the ambulance issues, is could they have been transported any other way without jeopardizing their health? For example, someone fell, maybe bumped their head or something, ambulance was called, they transported them to the hospital, yet they weren't like passed out or anything like that. They just maybe had a bump on their head, and they could have been transported some other way. I've seen ambulances, Medicare deny those transports because they could have been transported some other way without jeopardizing their health. So that's just some of the things that I have seen. So, was Medicare coverage rules followed? Now, that's the biggest thing. And you can actually find the policies and procedures of Medicare in internet manuals, because I have to do this a lot. I have to look up some of the rules and regulations a lot to see if it was fraud or not, or if maybe I can help somebody with an appeal, something like that. So in order to look these manuals up, CMS has 22 internet-only manuals. usually it's under like the CMS.gov. You can, and I'll show you how to find those here a little bit later. So this is some of the things that you can find. It expands upon the regulations, interprets, gives you more details, and incorporates the CMS guidance and the transmittals and binding on the CMS payment contractors and the MA plan. So you can see pretty much anything, and sometimes it's very it takes a while to go through some of these manuals because you have to sometimes go to different manuals as to figure out what it as to why Medicare denied it. So how do you find these manuals? You can find them. Go to the CMS.gov website. You'll go under Regulations and Guidance. So you hit that at the top, and then it'll take you to this, and then it'll scroll down to the top 5 resources, and then it'll have manuals. So you click on manuals, and then after you click on manuals, it'll bring you to this page. So you'll click where it says Internet-only manuals. So you'll click on that, and it should bring you up a page of all the manuals. Now, you can filter some of these, hit a keyword, and it'll bring up the manuals that you might need or the different ones. I said it may bring up more than one different manual, but at least it gets you to the right place. And I said some of this takes a little while to go through. But these manuals come in really handy, especially if you're having to help someone file an appeal or something like that. So it might help for them to do their homework or you to help them do their homework to hunt these up. So that's how you can find out all the Medicare rules and policies and regulations and criteria that was needed for a certain service. So also another thing that I have really seen is did the provider submit the needed paperwork? I said, did they state medical necessity in there? Especially with the ambulance. I've seen several ambulances get denied because the doctor didn't state medical necessity as to why they needed to be transported, like from the hospital to the skilled nursing. Is this a service that requires prior authorization? Now, some Medicare procedures require prior authorization before they happen. Did you, and especially this is for Advantage plans. Advantage plans, most of the time they require a referral for a specialist. Did you get that referral for that specialist? So that's just some of the things that I have seen and that needs to be done prior to you getting the services. And most of the time the providers actually know what needs to be done for a certain service for Medicare to approve it. So, of course, if Medicare denies something, beneficiaries does have appeal rights. They can file an appeal. If a service or item isn't covered and they think Medicare should have covered it, payment for a service or item is denied and you think Medicare should have paid for it. Another you question the amount Medicare paid for a certain service. Like you think Medicare may have paid too much for this certain thing that you got. So they can actually appeal that also. So was the claim denied? Here's some steps that I think beneficiaries need to take or volunteers, if they're helping a beneficiary, to do before actually filing the appeal. Read their Medicare summary notices or explanation of benefits. Of course, usually in the note section, it'll tell why it was denied. So after you see that, you need to consider whether to appeal or not. Another good thing I tell beneficiaries, if Medicare's denied something based on, medical necessity or something like that, talk to your doctor to see if that, provider can do an appeal for you and maybe they forgot to add that medical necessity paperwork. Talk to the doctor to see if they can help in any way, if they can, submit the claim again with added documentation, anything like that. So ask the physician for support. Ask them if they can appeal on your behalf. Ask them if they can provide you with more documentation so that you can submit that with your appeal. Any additional documentation will help support that. So gather as much additional documentation that you can. Even other doctors, like if it's a specialist, get something from your primary care doctor, get something from the specialist doctor. Any other documentation would be helpful. So the next thing to do is request the determination or, file the appeal within 120 days from the date that they got that Medicare summary notice in the mail. So there's a date on the very last page of that where it says, how to file an appeal. It's that very, very last page. There's a date on it that they have to submit the appeal by. And another thing, and this gets I know this gets very frustrating for some beneficiaries. If they receive an unfavorable decision for that first, appeal, keep going to the next level of appeal. Don't give up. Persistence is key. I know I've had several that have actually gone all the way up to the administrative law judge, and they finally got the appeal, but they almost gave up after the very first unfavorable decision. I was like, no, we need to keep going. So they need to keep going, and I know it takes a lot of time. It does take a lot of time, but it could pay off in the long run. So, as I said, persistence is key.
Hey, Loni, is this a good time to ask some questions? Because actually one of the questions and comments kind of relate to that last point.
Okay.
So the first question that came in, is there a difference between HMO and PPO Medicare Advantage plans regarding networks?
Sometimes they do, yes. Some HMOs and some PPOs have different networks. Okay. So you'll have to ask they need to ask the provider specifically, this is the Advantage plan that I'm on, whatever it may be. For example, like Blue Cross Blue Shield, they've got like Garnet, Diamond, I don't know what all they have, all the lovely Ruby or whatever. I mean, they need to ask the provider, I take Blue Cross Blue Shield Garnet. Do you accept this one? Because they may take Blue Cross Blue Shield, but they may not take all of the Advantage plans. So it's very specific.
Exactly. And
that they ask that provider.
Definitely. And as SHIP volunteer counselors and staff counselors, it's our job to give that beneficiary some homework and say, you need to call all your doctors, specialists, hospitals, skilled nursing facilities, anybody and everybody, to see if they accept the plan that you're interested in before we click that enrollment button.
Yes. One of their primary care physician may take the HMO, but one of their specialists may not. So they'll have to find a plan that takes all of, unless they want to change providers. I mean, of course, that's up to them. Exactly. But, at least we've made them do their homework.
Right. Another question came in. If a hospital is out of network, does your insurance have to pay if it's an emergency?
Yes, and that's I was going to be getting to that. Yes. In emergency situations, if the hospital is out of network, yes, that is one of the exemptions is they have to receive care. We'll cover out-of-network care if it's an emergency and urgent situation. Yes. So the Advantage plans will, and that's the only exception, is if it's an emergency, as in about to die kind of thing.
Yeah,
or
emergency
serious.
In Medicare language, emergency means threat to life or limb.
Yes.
That's kind of the broad emergency definition. And then there was a comment that definitely goes along with what you were saying last, Loni, with being persistent. We have a volunteer whose claim was denied 3 times and then finally got paid. They didn't talk to anyone but providers, so don't panic, stay calm, be patient, is some great advice from a volunteer. And there was one other question. How do you determine if an ambulance is medically necessary?
Well, that's something pretty much you have to go through, policies and procedures, some of the things, like if they're having breathing problems and they have to put oxygen on, low blood pressure. It could be, it could be a gambit of, if they just stretched them pretty much on a stretcher and they didn't do anything else to them, like put oxygen on them or, anything like that on the ride, it's like, okay, well, maybe they could have ridden in a different vehicle, for example. You know what I'm talking about?
Mm-hmm.
Like if they didn't break something, something is not seriously needing medical attention right then and there, then that's something that, that they maybe could have ridden in a different vehicle as long as it was not jeopardizing their health.
Another comment came in from a volunteer that will help definitely determine the emergency situation. 3 words which can help any appeal: clinical objective findings. So tell them to request acute or actual medical documentation from the doctor or ER visit notes or discharge summary. So you can get a lot of information from those notes as well from the provider to go along with your appeal. I agree with that 100%.
Yes. Any medical documentation, anything and everything. A letter from the ER doctor, anything that can go along with your appeal would help.
For sure. And then we had one other comment. I've seen some PPOs that will accept out-of-network, but at a lower percentage of the cost. Is that still valid?
That's up to the PPO. Advantage plans run things differently. So you just have to follow your plan's policies and procedures pretty much.
Yeah, and as many of you and all of you know through going through training, we use the Medicare.gov Plan Finder, and that will show PPOs in-network, the copay, and then out-of-network percentage. So it mainly, with the lower out-of-network percentage, generally speaking, is more Medicare Advantage Plan PPO kind of thing, and not necessarily an HMO, though there are some that may have out-of-network copays or costs. Another comment came in, needing treatment during transport is usually a key to Medicare covering the transport.
Yes.
So that's another key thing. And then another volunteer commented that she has a Blue Cross Blue Shield PPO and they pay 50% out-of-pocket network or 50% out-of-network providers. So there are some PPOs out there that do have that lower percentage going out-of-network. Yeah.
They just have to check with make sure they do their homework before they sign up for an Advantage plan. What do they pay for out-of-network? Do they pay it all for out-of-network? So they need to do their homework before they ever sign up for an Advantage plan to make sure it's going to be the right fit for them.
Exactly. And that's all the comments and questions. So, Loni, I'm going to turn it back over to you to proceed with your presentation. Thank you.
Okay. So now we're going to be talking about how to appeal in Original Medicare. So, of course, if they're in Original Medicare, they get a Medicare summary notice in the mail. It pretty much tells, why Medicare didn't pay it, who to contact if they need help filing an appeal. And, of course, SHIP's name is there, just FYI. How and where to file an appeal and how long you have to appeal. Now, I said that's that date, that 120 days out, that they need to send the appeal in by. So, next thing is, collect as much information that you can, doctor's notes, medical records, anything that will help support why you think Medicare should have paid this. And next thing is keep a copy of everything, even the appeal. So keep a copy of everything before you mail it in. And also you actually have the right to a fast appeal in certain circumstances. So if you can, ask for the fast appeal. So you never know. It might come in handy. Okay. So, okay. So, of course, here is the very last page that I've told you all about, that you can help someone file an appeal by. And there's actually steps that you can take. Next thing on here is, did you disagree with the coverage decision, payment decision, or payment amount on this notice? You can appeal. And there's that date that in that box that you have to send the appeal in by. Now, Medicare will actually hear appeals past this date, but just keep in mind they may not look at it just as soon as what you thought they might. So, fast appeals in regional Medicare. So ask your providers for any information, documentation, medical records, anything like that. Request a fast or expedited appeal, and in order to do that, you can call the Beneficiary and Family Centered Care Quality Improvement Organization, of course, no later than the date listed on the notice. So if you miss the deadline, you still have appeal rights. So that's a good thing. But as I said, please need to try to get it in before that date. Medicare will actually look at it faster if you get it in before that date. So here's the actual appeals process. There's actually 5 levels of appeal. Of course, you got your initial decision. That's usually the Medicare contractor, the MAC, the MAC, that actually does that initial determination on if Medicare denied it or not. So the next level that you usually go to is that redetermination. So the MAC redetermination, usually they have like a 60-day time limit, so you should hear something back within 60 days for that first level of appeal. So if you appeal after that, of course, then they've got you got 180 days to appeal after they first denied you. So then that second level of appeal that you go to is the QIC, the Qualified Independent Contractor, who hears them, and then they've got 60-day time limit. And then after if you appeal that one, you've got 60 days to appeal that decision. So that actually then takes it to the Office of Medicare Hearings and Appeals, which is the administrative law judge. And they've got a 90 days. So the administrative law judge has 90 days to look at the appeal. And usually the administrative law judge, they'll call you and set you up like a hearing over the phone, where everybody will present you and they'll call you in. It's like you don't have to go there. So they'll call you in on that, and so there's a 90-day time limit for that. So if that doesn't go your way, then you've got 60 days to appeal that, and that actually goes to the Medicare Appeals Council, and they've got 90-day time limit for processing that appeal. So if the unfavorable decision for that one, then you've got 60 days to file the appeal, and then the final one goes to the federal district court. So, and they've got several days to actually hear that appeal. And keep in mind, it has to be over a certain number amount. It has to be over $1,560 in order for the federal district court to actually hear it. So just keep that in mind if you get that far. Most of that I have dealt with has not got past the administrative law judge. But I said keep going, because you really never know. And keep calm, because it does take, and that's why I put this chart on here. It takes, they've got certain day after days to file, and you've got so many days to file, and then they've got so many days to decide to make a decision. So it could be like a good year or so before you hear anything, or especially if you keep appealing. So I highly encourage people to persistence is key. So, does anybody have any questions? I know one thing I didn't talk about, and I should have put in here, is the Advanced Beneficiary Notice of Non-Coverage. Now, that is a form that providers are supposed to give beneficiaries if they know that Medicare will not pay for a service. And I've been telling beneficiaries, do not sign a blank one of those. And sometimes they slip those into all that stack of paperwork that they give you to sign. Make sure that you do not sign a blank one of those. If you do, if you by chance do sign one of those, they give it to you blank, write in bold letters, "This is blank," and don't even sign it. Because that way, and make sure you get a copy of that. Because if you do sign something, make sure you get a copy of everything that you sign. That way you can prove that it was blank. If they come back, if Medicare does deny it, and for some reason that's not filled out. So just keep in mind of those kind of rules. Don't sign anything that's blank. Get a copy of everything that you sign. So because if a provider does not provide you with a advanced beneficiary notice of non-coverage, they're the ones that are responsible for the payment. So we're all here to questions. Does anybody have any questions? I know I went through some of this pretty fast.
Loni, we did have one question come in. And another one did. Let's see. Are any costs attached at any level for the patient?
What do you mean? I'm not understanding the question.
I'm just reading it as it's written.
Okay.
So maybe they're asking, is there a certain level of cost based on the patient's reason for being in the hospital or being charged? Of course, if the doctor does take assignment, there's those charges, the Medicare approved amount that the doctor has agreed to take. And of course, Medicare only pays 80%, so you have to keep that in mind with the beneficiaries. Medicare only pays 80% for a majority of the services. So you are responsible for that 20% unless you have a supplement or a Medigap policy to cover that 20%. Okay, a little bit of clarification came in. Do they have to pay for an attorney or support in appeals? Or, like, in other words, is there a cost to an appeal, is what it sounds like? No,
they do not have to have an attorney to file an appeal.
And as SHIP staff and volunteers, we can help with the appeals process. We don't go over appeals in volunteer training because, well, we want you guys to volunteer. So if there was ever any questions on appeal or how can we help a beneficiary appeal, please feel free to refer that on up to your local coordinator, Loni, or myself to help the beneficiary. They shouldn't have to go through any kind of legal services to do that.
No, they don't have to get an attorney, to file an appeal.
Okay. Another question came in. Any suggestions for what to advise clients who go through the appeals process and get notices and calls from collection agencies about these past due bills?
Just tell the provider, especially, that you're not going to pay this because you have sent this to Medicare for an appeal. Tell the provider that. Tell the collection agency that. Most of the time, they'll put it on hold because I've had collection agencies put it on hold, knowing that there's an appeal process, that you're going through the appeal process. But the important thing is letting the providers know that this was denied, and especially if you're trying to get more documentation from them, let them know that this was denied. Is there anything that you can do to help me with the appeal? Just let them know, hey, I'm not paying this bill until we go through the appeals process. Just communication with the provider is very, very key.
Great. Another question came in. Can you explain the inpatient again?
Okay. So you've got two types of admissions. You've got your inpatient, which means they're actually inpatient in the hospital, and then you've got your outpatient observation. Most of the time, if they're admitted for observation, they're in there as an outpatient. So inpatient is your Part A. The outpatient observation is under the Part B, And a big thing about that, if they go under observation, Medicare denies the self-administered drugs that they're given while they're there as under observation. Medicare will not pay for self-administered drugs. They will if they're inpatient, because that's part of the inpatient stuff, the bundle billing for inpatient. But they are not if they're in there under outpatient observation, because all that comes under their Part B, as in boy. Now, some can submit the claims to their Part D, but I've seen most of the time that they're that the hospital is not a Part D provider or is out of their network for their Part D. I've seen some of that. So I've been telling beneficiaries, if you're going in the hospital, take your medicines with you and ask the hospital, especially if they admit you under the outpatient observation, to see if you can take your pills while you're in the hospital. Some hospitals will let you, some won't. So it depends on the hospital and their rules. Any other questions?
Yep, and a couple more came in. Can an appeal be handwritten or does it need to be typed?
It can be handwritten, but it needs to be legible. CMS needs to be, or not CMS, but the contractor needs to be able to read it and understand it. So if their handwriting is really good and, you can read it and understand it and it's legible, it can be handwritten. I highly recommend typing, spell checking, all of that. That's what I'm saying, volunteers. And even me, SHIP and, SMP, I highly recommend if you're sitting there with a beneficiary and you have the capability of with a computer with you, just type it out and have them sign it. That way it's legible, it's spell checked, things like that. But handwritten is fine as long as it's legible.
Okay, a follow-up to that one before we get to some other questions that came in. Can it be written in Spanish, another language than English?
Yes.
Okay. Another question, just a clarification on flu shots for someone over 65 on Medicare. If they got a flu shot last year in October, they must go past the date to get one this year, even if this is a preventative procedure?
I think they have to wait till October because I can only get one per year.
Right. So earlier you mentioned it has to be
like
that.
They can't get it in September, for example. If they got it in October last year, they can't get it in September.
So, like, if they got it October 15th, they'd have to wait until October 16th of this year to get it.
Or the 15th. I mean.
Okay. Let's see. Doesn't pay for self-administered drugs. Is insulin included?
Insulin is most of the time insulin is self-administered. So, yes. Any of the medications that a individual gives to themselves.
It's also important to note that when you're admitted as an inpatient in the hospital, you can get medications only for the reasons why you're in the hospital. So, for example, if you have a heart attack and you take a regular blood pressure medicine and you get that same blood pressure medicine in the hospital and they say that is a contributing factor to why you're in the hospital will cover it. But if you needed insulin and that didn't have anything to do for the reason why you were in the hospital, then it's self-administered and you would need to get permission to do that yourself. That is all the questions that have been chatted in so far. And I'm looking. Oh, go ahead.
Yes. Loni and Sydney, this is Doug Dillon. I've got a question on the advanced beneficiary notice.
Yes.
If they check the box, which they are acknowledging Medicare may or may not pay for this procedure, but it allows them to appeal if it's denied, does that pretty well submarine what they're doing, even though Medicare will state, they may or may not pay for it, and they can appeal if Medicare does?
Yeah, they can still appeal it even if they sign that advance administration notice of non-coverage.
Yeah, as I understand, there's 3 blocks, and one of them is only one. If they check the one that says may or may not, and they can appeal. The other 2, they lose the appeal.
Yeah.
Okay.
Yeah. And I don't know if I can bring. Let me see if I can find one real fast. Okay, let's see here. Ooh. Pardon me just a second while I find a. I'll see if I can find a thing real fast. Okay, can y'all see that? I don't know if I can make it bigger. Can you all see the image? What Doug is talking about is there's 3 options. Option 1 is I want the blank listed above. So that's what I'm saying. They don't need to sign a blank one. You may ask to be paid now, but I also want Medicare bill for an official decision on payment, which is sent to me on a Medicare summary notice. I understand that if Medicare doesn't pay, I'm responsible for payment, but I can appeal to Medicare following the directions of the MSN. If Medicare does pay, you'll be refunded and payment I made to you less copays or deductibles. So that's the first option. Second option is I want the blank listed above, but do not bill Medicare. You may ask to be paid now as I'm responsible for the payment and cannot appeal if Medicare is not billed. The third option is I do not want the above listed service. I understand with this choice I am not responsible for payment and cannot appeal to see if Medicare would pay. So there's the 3 options. So, yes, the first one, if they check A and Medicare, they submit it to Medicare and Medicare denies it, then they can still appeal it. If they check B, then they can appeal, or check option 2, no, then they can appeal it. And, of course, option 3 pretty much is saying they don't want the service at all. So can everybody see that advanced beneficiary notice and non-coverage form?
Loni, could you do me a favor and save a copy of that and send it to me, and I can send it to everyone in the follow-up email with the survey. That way everyone has a copy of it. I think that would be very helpful.
I have to download it. That come from Norton. I'll have to download it. I can send it to you. Okay.
Perfect.
All righty. So let's get back. Okay. Any other questions?
There is a question. What is the appeals process for prescription drug plans Part D?
Okay. It depends on the plans, how you're supposed to file the appeal. So another thing, of course, you can ask the pharmacy to make sure. Another one is to make sure the pharmacy's in the plans network. That's another thing. Sometimes the pharmacist or the pharmacy can actually file the appeal on their behalf. Sometimes, there's different reasons as to why, something was denied for prescription drugs. Sometimes you have to do the step therapy. So there's other medications you have to try before, like lesser of or whatever. So you have to, sometimes you have to follow those. Sometimes there's quantity limits. Sometimes you have to get prior approval for some medications. So it depends on, exactly why it was denied. If, for example, your physician can say, we've tried these other medicines and he just forgot to, provide the documentation or whatever with that, then, or, the beneficiary is allergic to all these other medicines, this is the one that they have to be on. As long as your provider and your pharmacist can get that worked out, that would be good. Sometimes they can do that before, having to file the appeal. So just follow your plan's appeal process, and they usually send that in that paperwork that they send usually during the year or before your plan starts. But as I said, there's certain reasons as to, you know, why it was denied, that you have to prove before that. But it's pretty much the same reason, same, almost like the same appeal ways.
Right,
So,
and this is, Sydney, just to kind of add on to what Loni's saying when it comes to step therapies and quantity limits and things of that nature, like she mentioned, all of those things are listed on the Medicare.gov plan finder that we use. So whenever you're doing a comparison, it's important that you look for those access to drugs that are listed, and if anything says yes, they have a quantity limit, or yes, there's a prior authorization, or yes, there's a step therapy, that you highlight it or really make the beneficiary aware that, hey, you may have a couple steps to go through in order to get this medication. We're seeing it a lot more on narcotic medications. We're seeing it on medications for dual purposes. For example, transplant medications like prednisone. Some are used to help with transplants. Others are used for other illnesses. So there's usually quite a few prior authorizations on those to make sure that it's being billed correctly and the right part of Medicare is being billed. So it's important to look at those before we tell a beneficiary, this is one of your most cost-effective drug plans. But
another reason is it's not on the formulary. Another one would be, you know, it's not that medication is not listed on the plan's formulary, and they can ask for a formulary exemption prior to that. The off-label use, if you can get really good documentation from the providers, that you know, sometimes they get the prior approval for those, would be really good. So that's just some of the things that I've seen as to why Medicare may have denied it, or the Part D may have denied it. So, but I highly encourage, you know, beneficiaries, if their provider is saying this is the medication you need, just be persistent and, you know, go through those steps that they need to go through, jump through the hoops. So that they can get that medication that they're needing. There's other ways of getting that medication, you know, while they're going through these hoops. For example, maybe the provider may have some samples that they can get that would help them get through until they get, you know, either the prior authorization or, you know, whatever the appeal process done.
We did have another question come in. On appeals where the patient has just made the wrong decision, is there any considerations for the poor patient being freaked out due to the medical emergency?
No, I don't think so. I said it all comes down to medical necessity. Just because they were freaked out doesn't necessarily mean it was medically necessary.
That's where the clinical objective findings come into play.
Yes. If you can prove that and have that under documentation from the ER doctor or whatever, the medical records.
That's the key.
I mean, it never hurts to file an appeal. Never hurts at all.
I always say appeal anything that you're not happy with.
Yes.
And again, as volunteers, if you're not comfortable with the appeals process, feel free to refer that up the chain to your local or regional volunteer coordinator, your regional coordinator, myself, Loni, if a veteran volunteer who's been around for a while wants to help you out. You know, always ask for assistance. It's okay to say, I'm not sure. But we have to always make sure that we do that follow-up and make sure the beneficiary's question is answered or the assistance for the appeal is being made. Let's see. If there is no one with them to take them, then could they not consider this?
No. Then they could have called somebody. And I've seen this before. They could have called somebody.
Okay.
Taking a cab.
Yeah, taking a cab, Uber, Lyft.
And there's a lot of considerations for that, and that's really where the appeals process comes in. My story at every training, and, I feel like a broken record. People have heard me talk about this all the time. I had a lady and a husband. The lady was maybe 90 pounds soaking wet. Her 300-pound husband fell in the bathroom and broke his hip. She called the ambulance. The claim was denied because they said she should have been able to transport him. So on the appeals notice, we said she weighs 90 pounds, he weighs 300 pounds. There was no way that she could have. What?
Plus, he broke his hip. That's a medical emergency.
So, always even the littlest detail could really help with an appeal.
Yes.
We also had another scenario come in. Recently had to sign an ABN for an A1C test. Medicare did pay $11.99 on the $60 bill. Had it been denied by Medicare, would I have had any access to the same discount that Medicare paid, or are we always responsible for the higher bill, such as in this case, in the $60?
It's the Medicare approved amount that you would be responsible for. That's if the provider takes assignment. Keep in mind, there's three different types of providers. Did they take assignment? So were they participating provider? Were they non-participating provider? Or was an opt-out provider? So keep in mind, if it's a non-participating provider, they can still bill it to Medicare, but then there's that 15% more charge that they can actually charge you. Then keep in mind, then the approved amount. So it's still based on the Medicare approved amount.
Okay. We did have another comment come in, but I'm asking for clarification on it because I'm not sure exactly what that means. So there's no other questions in the chat box, and I don't see anyone's hand raised for additional questions. So if anyone has questions, please raise your hand or submit it in the chat box. How about I do this? I'm going to stop the recording, and that might, help people want to ask questions. So we thank you again, and I'll let Loni kind of finish up.
Yes, I want to thank you all for attending today. Please, we'll stop the recording here in a little bit, so if you have any questions, I'll ask them. But if you have any issues or anything like that, please don't hesitate to call me, email me, or anything like that, because I can do some of the research for you if need be through all those manuals that CMS. There's 22, so it takes a little bit of research. But I'm more than happy to do that if you're needing wording for an appeal or anything like that. I don't care to do that for you. That's what we're here for, is to help you help the beneficiaries. So I guess, Sina, you could probably stop the recording now.